Andrew Jimson described Jeremy Hunt as a man who offered his enemies no point of attack. The health secretary, he said, wore an armor of smiling friendliness, spoke a language of impenetrable blandness, and had devised an NHS policy which focused people's minds on how to improve the service, not on how to defend it against some imaginary plan to flog it off. This makes Hunt, he said, a difficult man to write about. We feral beasts prefer to sink our teeth into a disaster, a crisis, or at least a gaffe. As far as I can see, I'm sorry to keep on quoting Andrew Jimson, but he said, I apologize to anyone, but I have never managed to see anyone who's written an amusing profile of Mr. Hunt as Health Secretary. He has achieved the extraordinary feat of making his portfolio seem quite dull. Secretary of State, you have lived through and survived one junior doctor's strike, the first ever in NHS history. There are others looming. A new contract imposed on 54,000 junior doctors in the NHS, and now, as I say, a series of rolling strikes. Hardly a quiet life. Do you think Andrew Jimson would change his mind now?
Thank you, Tim. A wonderful introduction. Andrew Jimson also described me as the politician that most similar to a children's TV presenter, which I think was meant to be, from a political journalist, a big insult. But I think I've given him and other people a bit more to write about for actually very unfortunate reasons in the last year. But thank you for introducing me. Thank you, everyone, for inviting me to Expo. And congratulations again on an absolutely fantastic show. I think it goes from strength to strength. We've got new and exciting things, new faces here this year, but the buzz is there, and I think that says a huge amount about the way things are really changing in the NHS behind the headlines, and in a way that sometimes isn't picked up in what people read in the papers. I'm also delighted to come back here as Health Secretary after our change of Prime Minister. There were one or two moments when I wasn't sure that I was going to be coming back as Health Secretary. I used to say that I had the safest job in the Cabinet because no other Cabinet Minister wanted it. But I'm not sure that it did feel like that at every moment during the course of this year. But what I would say is, looking after public services for the people who vote us in at elections is always core business for any government. But health is different. It's got a bigger budget. Our budget is double the education budget, 3 times the defence budget, 10 times the police budget. It arouses bigger passions. If you ask people in survey after survey what makes them most proud to be British, they say it's the NHS, ahead of the royal family, ahead of the armed services, ahead of the BBC. It's right there, and indeed, we are more proud of our health system. 58% of us are proud of the NHS compared to 39% of Germans. So it's a connection that runs very, very deep. And the other big difference is that we are much, much more affected by changes in technology and science than any other sectors. Whether it's this morning's story of an exciting new immunotherapy drug for pancreatic cancer that shows great promise, whether it's the incredible potential of genomics. A couple of young girls recently were diagnosed at Great Ormond Street having a rare genetic disease that they haven't been able to understand what it is for their entire lives, and genomics has made that possible, and that's a totally extraordinary change. Or it's the changes that we're about to see. Bob alluded to some of them in his inspirational talk earlier this morning, but when I went and met Bob Wachter this time last year in San Francisco, on that same visit, I met scientists who describe how in one drop of blood there are 300,000 biomarkers, and they predict that within the next decade, rather than going to a doctor for a diagnosis, most of the time we'll be taking a monthly blood test at home, which will analyze those 300,000 biomarkers and we'll be able to spot disease much, much earlier than we are able to at the moment. And many people think that the changes that we are about to see in healthcare will transform humanity by even more than the internet has done over the last 15 years. And so in that context, it's very important to be clear-headed about where we want to go with the NHS, which is why Expo is actually a very, very big statement of intent. And I would say that if you look at the internet, it's a very important comparison. Most of the changes that the internet have brought about, they've improved customer service in many areas, but they are essentially driven by efficiency. So if you look at the airline industry, they're saving about £2 billion a year in this country because of the move to booking our tickets online and so on. The banking industry now, 90% of transactions are done electronically. They are 100 times cheaper than the old days when we used to go to the bank with our checks and pay them in. And in healthcare, we have that same efficiency gain. The NHS used to be, I'm praying it still isn't, but it used to be the biggest purchaser of fax machines in the world. And this was because every time someone was discharged from hospital, the hospital would faithfully send a fax to the GP surgery with a discharge summary. I'm pleased to say now 70% of trusts do electronic discharge summaries. And so we're moving away from that. But those efficiency gains are very, very important as we try to stretch limited resources to the increasing aspirations that we have from the NHS. But what I want to argue today is that there are two very profound ways in which, again, this electronic revolution is quite different. And one of them Bob said very powerfully this morning, which is there is an immediate link to clinical quality and safety. So if I give you an example, 10 years ago, if you went to an A&E department in this country, they wouldn't have known anything about you. And they would have then had to make a judgment about the person who walked through the front door of that A&E department purely on the basis of what they saw. And obviously, if you were unconscious, that's a very difficult process to go through. Now, 77% of A&E departments have access to the summary care record, which is actually something we've inherited from Connecting for Health, the IT program that Bob was talking about. And of course, that is transformational if doctors know your allergies, if they know that you're a diabetic, if they know some elements of your medical history. And so there's a direct impact on clinical care and safety. But there's another change as well, which technology makes possible, which is it puts power for the first time really in the hands of patients. If you're able to Google your symptoms, information leads to power, leads to decision-making, and leads to autonomy. And that is a change that some people describe as the democratization of healthcare. Some people say this is going to lead to a completely different relationship between doctor and patient, where patients are, for the first time, in the driving seat of their own healthcare. And I want the NHS to be absolutely at the forefront of those changes. I've been Health Secretary now for 4 years and 3 days, and I've always been very enthusiastic about technology, and that was why I came up with the original paperless 2020 commitment. But when I went to California last year, I thought it's time to actually just take stock. And I just want to say a word about Bob, because Bob, I think, has done a truly extraordinary service to the NHS with his report. I wanted Bob to do this because, and he won't mind me saying, I think he resisted a little bit at the start because I think he sensed that it was going to be a huge undertaking, because the tech world is full of visionaries who say the future's bright, the future's exciting, amazing things are going to happen. There are many fewer people out there telling you how things can go wrong. And I'm going to give Bob's book a real plug here, because The Digital Doctor is a fantastic, the best exposition I've seen of how things can go wrong, how things did go wrong in many ways in the US, but also not losing that excitement, optimism, the sense of possibility. And Bob talked a lot about how we have a lot less money in this country than they have in the US. What he was too modest to say was that on the basis of that, he agreed to do his work for absolutely no fees at all. So that's why I'm very happy to plug his book by way of a thank you. But I would just like to thank Bob, his wife Katie, the committee who worked extremely hard, and also Harpreet Sood from NHS England. I think they did a fantastic job, and I think we should just recognise it. Now, one of the things I said to Bob was, we do unfortunately in the NHS have a bit of a tradition of very worthy reports being published in a blaze of publicity and then quietly gathering dust on a shelf somewhere and never being implemented. And Bob has cleverly made sure this is impossible by making sure the report is only online. But this is too important to ignore. And what Bob, I think, is very clear about is that we're doing very well in the NHS when it comes to primary care records. He was kind enough to say that we are world class. And in fact, 99% of GP surgeries offer online appointments. 98% offer the ability to do repeat prescriptions online. 97% allow you to access your medical record online. And that, combined with the completeness of the GP electronic record, gives us great potential for the future, because we now have a good medical record, and the question is how we get it around the system. And that's a good start. But he was also very direct in his message to us that our hospital IT systems are not up to scratch. And that's why I think his report is a sobering read, but a very important read. And so I think it's very important that I now explain how I think we want to draw the lessons from what Bob said. And I think the single biggest point that Bob makes about the way hospital IT systems work is that there is huge variation in the system. Just as we know there's huge variation in clinical quality, and we're making huge efforts to reduce that variation, we still have huge variation. I can think of an A&E department that I visited where a nurse told me that 2/3 of her time in the afternoon shift is filling out forms to get patients admitted. And in that particular hospital, they had, I think, 14 different IT systems. Every department had its own IT system. You compare that to somewhere not far from here, Salford Royal, which has a very good IT system. And not only that, but it's interconnected with community healthcare and the GP healthcare system in a way that I think is really world class. But Bob's honest observation is that none of our hospital IT systems anywhere at the moment are world class. And that is not good enough for the NHS, and that's what we have to change. And so then the question is how we get there, and I think he is absolutely right to say that people will need to go at different speeds. A hospital in special measures, which has severe problems with their A&E performance or their waiting times or whatever, may not be ready to invest in a huge IT transformation program, and we need to recognize that. But I think the first thing we want to do is to make sure that we have a group of hospitals that by the end of this Parliament really do become world class, if you like, an Ivy League of hospitals. And so working with colleagues from NHS England, and I welcome Matthew Swindells to his job. I think he's a fantastic hire. But working with colleagues from NHS England, we are able today to announce that Ivy League of hospitals. There may be a few additions to this at a later stage. And we're calling them global exemplars, not because they are global exemplars now, although we're very proud of what they've done, but because our ambition for them is to become global exemplars in the next few years. And let me unveil the names of those trusts. And what does being a global exemplar mean? Well, the first thing is that they are going to have access to funding, to some of that 4.2 billion that was allocated to this very important job in the spending review, up to £10 million each, which we'll be expecting them to match fund. And that will help to really kickstart their IT transformation programs. We are also, for all of them, going to set up an international partnership with a hospital or an organization that we think has already got to where they want to get to. One of the lessons we've learned from the special measures program under the new CQC inspection regime is that buddying hospitals with other hospitals that have already done what they're trying to do is a very effective and often a fast way of making improvements. So I'm certainly hoping that Bob's Hospital, the University of California, San Francisco, will take on one or two of these exemplars, but places like the Cleveland, the Mayo, Harvard, Kaiser Permanente, places that are absolutely world-class, we are hoping will partner with our hospitals in the UK in a program to make them absolutely up there with the best in the world over the next few years. And then we have another group of hospitals, what Bob described as the B group, who are ready to seriously digitize. They may not be quite in the place that these global exemplars are, but we're going to call them national exemplars, and we are going to invite hospitals to apply to become a national exemplar. And they will get up to £5 million each initially. If they progress, they could become a global exemplar. So we're sort of getting our inspiration from the Champions League, the Premiership, and so on. But the thing is that that group of trusts will need support. And so we're going to do something for the first time, which I think will make a very big difference in terms of the support that we offer them. We are going to set up an NHS Digital Academy based at a UK university that will be a centre of excellence for helping hospitals understand the kind of lessons that Bob was talking about this morning, the things that can go right, the things that can go wrong, how to make a success of it, and how ultimately to become best of class in the world. And so today we are launching a competition to find a university partner for the NHS, because this will be based at a university, who can host the NHS Digital Academy. And I think that's a fantastic, exciting opportunity for any university to do. And let me just, I put up here some of the things that we're expecting to do. But one thing in particular, which is one of Bob's recommendations, is to help us train a generation of clinical leaders who are going to be the CCIOs of the future. And that is a big deficit in our workforce skills at the moment. I think one of the great insights from Bob's book is that IT transformation programs fail if they don't have clinical leadership. And I think one of the things that we have to make sure is that every penny we spend improves doctor productivity, because then we'll get doctor buy-in, nurse buy-in to these changes. So the NHS Digital Academy will be a very important part. And then just as we have in our football leagues, we will have the possibilities of promotion and relegation every year. But our objective is to bring everyone up to the standard of the very best by 2023, as Bob recommends in his report. Now I just want to talk for a moment about the other side to this technology revolution, which is the impact on the culture in healthcare and the impact on patients. And I want to put up a picture of someone who doesn't normally feature at Expo conferences, Angelina Jolie. And the reason I've put her up there is not just because she's a good way to cheer up a speech on health technology, but because she actually did something completely extraordinary a few years ago. She discovered that her BRCA1 genes gave her an 87% chance of getting breast cancer. And then she took to very brave decisions. The first was to have a double mastectomy, and the second was to tell the world what she'd done and why she'd done it. And I think that is an incredibly powerful example of patients taking control of their own healthcare destiny. And that is what is going to be opened up going forward if we can get this right. So today I want to announce 4 additional things that will really help put patients in control of their own healthcare destiny. And the first is around the website My NHS, which we launched a couple of years ago. It has 700,000 data points. It's the most comprehensive collection of healthcare information about any healthcare system anywhere in the world. And this is where people can see the quality of care at their local hospitals, their local GP surgeries, what's happening in public health, in a way that really gives people knowledge that in many other healthcare systems they wouldn't have. And we are going to improve that further with improved visualization so that people can plot the data in interesting and imaginative ways, improved customization in many areas, but most particularly we are going to be putting some new domains. So this was something I actually announced it was our intention to do last year, but we have now given Ofsted-style ratings by CCG area in dementia, diabetes, and learning disabilities. And dementia one we actually published in August. Diabetes and learning disabilities we are publishing for the first time today so that people can actually see how the quality of care they're getting in their areas compares to other areas. And over the next couple of months, we will be doing the same for mental health provision and for maternity as well. So this is a big step forward. The second area that we are announcing today is a move towards self-diagnosis. And I want to be clear, we are going to have a new online resource for NHS patients. What this is not doing is ever replacing the role of a doctor or a nurse or someone with clinical training who needs to make a clinical judgment about the treatment people need. But if I couldn't give the analogy so as to be clear about what we're saying, if we think about the 111 service, at the moment if you dial 111, you'll speak to a trained call handler who is not clinically qualified, and then they take you through an algorithm of questions, and on the basis of your responses, a judgment is made as to whether you need to speak to a clinician or not. And those questions, for many people, would be more convenient if they were done online. And if the result is that, having gone through that algorithm, you need to speak to a clinician, then that's exactly what you'll do. So this will be moving the front end, the non-clinical part of 111 online. And I think this is something that people will find extremely helpful. It's an online resource. People Google their symptoms the whole time, but wouldn't they like to have something that's trusted and approved by the NHS as a resource to give them more information? So that's 111. And then the third thing that we are announcing today, which again is an extremely exciting development, it is now possible for NHS patients to access their medical records online, but you do have to go to your GP surgery and get a password which you can then use in order to do it. We're going to set up something similar to the blue button system that they have in the US, where people will be able to access their medical record online without going into their GP surgery by identifying themselves through a series of security questions that we already use for other government websites, such as when you renew your driving license. And my intention is to launch that service at Expo next year. But I think that will be something that's really valued by many NHS patients. And then finally, we are going to make a very big move in the next 12 months into apps and wearables. I wear a Fitbit. Many people use apps. What's going to change with apps is the way that these apps link directly into our own medical records. And by March next year, NHS England are going to publish a library of approved apps in areas like mental health and chronic conditions like diabetes. We'll also, in the next 12 months, be having a competition because we think we need better apps than the ones that are available in the market. We don't want to develop them ourselves, but we want them to be developed by entrepreneurs who have specialist knowledge and the creativity to do this. And these will link into people's medical records. And again, we hope to announce those at Expo next year. Let me just finish by saying this, I think, is something, this direction of travel is something that is going to be warmly welcomed by the clinical community as well as by doctors. But clinicians know, when we look at the evidence from things like the expert patient program, that outcomes are better when people take ownership of their own condition and responsibility for their own condition. And I just want to finish on a note of optimism, because I'm incredibly aware of the pressures out there on the NHS front line at the moment. When I became an MP in 2005, there was huge national debates about the NHS, big protests about reconfigurations. I remember Patricia Hewitt was Health Secretary at the time. At the end of that decade, that government didn't get everything right, but we did have the lowest waiting times in the developed world for elective care and emergency care. And that was a huge achievement, and I think that decade will be seen as the decade when we sorted out access to care in the NHS. In this decade, we've had to deal with financial pressures, but we've also had to deal with mid-staffs, and we are now seeing the importance of quality and safety becoming absolutely central to everything we do in the NHS. We've got the new CQC regimes, a real push towards eliminating clinical variation. And I think this decade, at the end of it, will be seen as the quality and safety decade. And I think the next decade will be, because of all this technology, the patient power decade, the decade where we use these incredible IT systems to put patients in control of their own destiny. And let me just finish with a story about Ronald Reagan, who was once accused when he was president of being out of touch by a young student who said, you know, when you were born, you didn't have television, you didn't have space travel, you didn't have computers, you didn't have jet engines. And Reagan looked at him and smiled and said, yes, you're right. We didn't have those things, we invented them. And I think this is our moment to invent the future and make sure that we can carry on being proud of the NHS as delivering truly the best service anywhere in the world. Thank you very much.